CHS is a Kenyan non-governmental organization that focuses on supporting the implementation of impacting sustainable solutions to existing and emerging public health concerns. All this is targeted towards improving the health of communities. To make this possible, CHS utilizes local expertise and strategic partnerships to ensure a world of healthy families through evidence-informed solutions.
We have care and treatment services for adult and pediatrics, including pregnant women and their children. We have psychosocial services, that is APSC, monitoring and evaluation. There's PMTCT services. There's capacity building of healthcare workers. We have also capacity building by trainings and also monthly CMAs in the big facilities. Then again, we also support staffs from the PMO sub in all the facilities that CHS supports within Central Province.
One of the areas that CHS focuses on is the initiation of antiretroviral therapy, ART. Some of the treatment services we offer include laboratory and clinical monitoring of HIV infections, prompt initiation of ART to eligible patients, monitoring and management of treatment failure and adverse drug reactions. CHS also supports pediatric clinic days where family-focused care is provided. ARV is dosed by weight, and all infected infants less than 2 years receive ARVs. We support a pediatric-friendly clinic that promotes play therapy. Cervical cancer, as the second most prevalent cancer in the world, is currently affecting over 1 million women. It is a leading cause of death among women in developing countries. CHS seeks to provide high-quality cervical cancer prevention and management services by training healthcare workers on cervical cancer screening and management of precancerous conditions, running screening camps at health facilities for awareness. CHS is also involved in other reproductive health solutions like STI screening, counseling, and treatment. We also provide family planning services like dual contraception. CHS contributes to community health solutions by strengthening the capacity of communities to plan, demand and implement interventions. So far, we have set up a total of 11 community-based support groups.
CHS implements a community support program. The program has got activities at facility level, and it also has activities that we support at community level. So some of the key activities that we do at facility level, we try to support adherence, whereby we keep on counseling our clients, educating them so that they are able to adhere to their treatment. And we do that through psychosocial support. We have treatment literacy support groups at facility level. Then we also have peer educators and mentor mothers who works with the clients very closely through sharing their experiences so that they can be able to improve their adherence.
CHS inanisaidia, inanisupport. Ilinisupport nikaweza kupata mtoto negative. Ndio walinielimisha na nikampata akiwa negative.
CHS shares the UN goal to reduce child mortality rate and improve maternal health. We do this through our care and treatment programs for women and children. Pregnant mothers and infants who are less than 2 years old are given priority by receiving services in a one-stop shop. Our programs also encourage men to support women during pregnancy and delivery.
We've been able to define the strategy for the organization, set up organizational systems and structures, operational systems and structures, as well as continue to focus on our core business, which is supporting the health system in the country, particularly in Central Province, to implement HIV prevention, care and treatment services. Services that reach over 55,000 patients directly and hundreds of thousands who indirectly benefit from the services. Also spreading our support from the time we started off as a sub-grantee, supporting 29 health facilities to now currently supporting 192 health facilities within Central Province.
By look of it, and with a flashback of where we have come from, I feel this is one of the greatest achievements CHS has done, and this is maybe one of the biggest CCCs we have in this republic, although I have not visited all of them, but I believe this is the best.
When we started off with a sub-grant that was about $400,000 to now being a prime partner of the Centers for Disease Control and Prevention, that's CDC, from a PEPFAR grant, to now being a prime partner receiving about $4 million in our first year. We've been able to also increase our staffing levels. We're currently about 50 staff supporting the work in the province. Also in the time we have developed and disbursed sub-grants, a total of 25 to both district health management teams, district hospitals, and 2 CBOs working within the province that all support the work that we do in the province. In the past year we have had quite some achievements, particularly regarding our support for the health system. One of our key focus areas is health system strengthening, and in line with that we have strengthened our service delivery areas. So CHS will continue to focus on matters efficiency and effectiveness, and as a matter of fact in our current strategic plan, the 4th goal speaks to optimizing resources for maximum value, really. And this is really what the conversation of effectiveness and efficiency is all about. We intend to continue to seek strategic partnerships, both within the donor world as well as within both internationally and locally, to ensure that we can further harness our experiences in ensuring that we can improve the health system in this country. Going specifically to our service delivery areas, we intend to focus on certain key areas. One of them is adolescent health, because we know that this is an area that's a big gap. We also intend to continue further strengthening our support to non-communicable diseases within the HIV perspective and beyond. We also know that Central Province has made quite some huge strides in terms of the HIV response, and so we would like to further strengthen centers of excellence. As you may be aware, we have been supporting in the past year Murang'a, Thika, Nyeri, and Nyahururu to be centers of excellence. You know, Murang'a is already utilized for residential mentorship, where we are developing a sustainable approach where the existing healthcare workers who have quite some experience and are specialized are able to continue mentorship for newer healthcare workers where there are capacity gaps, and this is a sustainable approach. So finally, I'd like to acknowledge the key support we have received as an organization, particularly from PEPFAR through CDC. We are a prime partner, and we are really benefiting from financial and technical support from CDC. And having said that, I cannot fail to mention that this is all from the American people, and we are truly grateful to them. What the support they are giving us is making a huge impact in this country. I would also like to thank ICAP and Columbia University, who have been our strategic partner and continue to work with us on key areas or key program areas to find solutions that are both sustainable and effective in the places that we work. I'd like to thank the Ministries of Health, both Ministry of Public Health and Sanitation and Ministry of Medical Services, who we work very closely with as a key partner in this work. We would not be able to do this work if there wasn't significant investment from the government of Kenya to the Ministries of Health, and we acknowledge their support and the partnership. We'd also like to give a big thank you to other partnerships that we have established in the year, and I'll quickly mention Spillworks Media for facilitating the development of this clip as part of giving back to society, and we will keep looking for such partnerships moving forward.